Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
EIBI stands for Early Intensive Behavioral Intervention, EIBI. So it's early and it's intensive. So it's essentially, it's ABA that's provided to very young children. So children generally below the age of 4 or 4.5 even. And the idea with it is that it needs to be more intensive than an older child, only because that is the population with which, if you do a lot of intensive work, their possibility of coming out of the diagnosis and learning everything they need to in order to lose their diagnostic symptoms is higher. It's a higher probability because they're younger. So, and the programs are similar. They're to just general ABA. They're different in, I guess, 2 ways. One is you're looking at a comprehensive program, so you're very focused on all different areas of functioning. So, generally if I'm doing an early intensive program, I would be focused on language, because now you're looking at working with like a child who's 3 or 2, 3. And so I would be doing a lot of language work, some play, some early executive functioning skills. Clearly there's going to be some adaptive or self-help type stuff. And then maybe the beginning of social. Those are kind of the curriculum areas. You're not doing a whole bunch of cognitive skills, because cognitive skills tend to really develop after the age of 5. You may have to, depending on the child, do a bunch of stuff in motor. Depends on the child, really. And you're not working on academics at all. So really, that's what EIBI is. And the other difference is the format that you usually work with a child is more structured. So it's much more it's play to begin with, but it really by 3 should be very focused on discrete trial training. And I want to reiterate that. That's so important, because coming back into the field after 5 years, I see that a lot of people have moved away from structured ABA, and there's less and less of DTT going on, which is very concerning to me, because the progress that you make with DTT is much more than you do with NET, anything play-based, PRT, etc., because it's just a lot more structured and you're teaching faster. So I really do encourage a lot of DTT at that age.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.